It is a condition that is closely associated with women. But did you know that men do get fistula and that often it is a challenge accessing healthcare? So, what causes fistula in men?
Start with the rare ones, which are congenital, meaning that the child may be born with a fistula in the genitalia. That is quite rare. But then there are also fistulas that come from abnormalities of the urinary tract. When they undergo surgery, as a side effect, they develop a fistula. Another cause of fistula formation in the genitalia is a common operation known as circumcision. So as a side effect, some of the operations, depending on whether it is done by a qualified personnel or not, they may develop a fistula as a side effect so that urine is leaking from an abnormal position from the male genitalia.
Sexually transmitted diseases such as gonorrhea and chlamydia can also cause fistula in men, as can accidents and occupations such as boda riders, who are especially considered to be at a higher risk.
Trauma from these boda riders, when the parts of the genitalia are squeezed between the bones of the pelvis and the hard surfaces of the boda cycle, either bicycle or motorcycle.
Fistula patients are unable to control their urine or stool, and this often condemns them to indignity and ridicule. We meet Joshua at his place of work in Kariobangi South.
I met my wife with the catheter. I told her everything. Okay, reactions unajua lazima stuke. Hajaiona kitu kama hiyo, hajaisikia kitu kama hiyo. But later on, muda akikupenda shakupenda.
Starting a family was high up on Joshua's priorities, but desire and ability were incompatible for the young man due to his fistula condition, and never mind societal expectations on him. Joshua was slowly dying from inside.
Nalala tu hivyo. Ukuna mind yako okay, ukuna that feeling hata yako nayo, but you have to control yourself, and we did it for 1 full year.
He needed the catheter to drain the urine. He was aware of the limitations of his condition. A man who suffers from fistula or stricture is not able to reproduce. But the road to his redemption began when he was referred to a doctor in Kenyatta National Hospital.
They come to bed, they bed wet, they wear diapers, they're coming to sleep with a catheter because that pipe or catheter is a temporary diversion which of necessity we fashion to divert that urine, because you see they have to, urine is a waste product that of necessity it must come out.
The long-term solution to fistula often is surgery. Since the beginning of this year, Kenyatta National Hospital has carried out over 100 surgeries on men with the condition. Many more are on the waiting list. Dr. Otele's dedication to fistula patients is evident. We meet him in the theatre, attending to a 45-year-old from Homa Bay.
We're operating basically at 2 sites. The primary site, which is in the genital area, it has a fistula. So this fistula, we need to close it, and it's a big fistula. So we have prepared that site for grafting because of the size of the fistula. By grafting, I mean borrowing tissue from another site. From the same body of the patient, I'll borrow some tissue, human tissue, to use to close that fistula so that it does not recur again.
For a referral hospital in high demand, even getting a surgery slot is never guaranteed.
We could not do in the time frame of yesterday's theatre list, so we've scheduled this patient for theatre today. That's why we are here. We've just borrowed space to be able to carry out this patient. This patient comes from very far away, comes all the way from Homa Bay, and he doesn't walk around, he doesn't have relatives, he doesn't stay around. So we have created this space to carry out this exercise so that the patient is not inconvenienced.
It is a complex operation that is also labor intensive.
On one day you may be able to do 1 or 2 operations, or sometimes 3 if you are very lucky. In one whole day, you've gone in at 8 o'clock, you leave at 6 in the evening, and you have only operated 3. Because these are not operations which you can rush. These are very complex operations that you'll be operating like more than one site. So the operations are also complex, and the turnover rate is slow.
Dr. Otele has set aside a 24-hour hotline that his patients can reach him. He knows that sometimes what they need most is a listening ear.
Then we felt that we needed a forum also to address the same in the male persons. And the male persons unfortunately think that this is a normal thing, and they think it's not in keeping with the male gender to keep talking about their personal problems. So they tend to suffer in silence, and we thought that we break that stigma and we bring out these things to the surface so that we can find a solution.
Fistula hits men from poor backgrounds hardest because they cannot afford to prompt medical attention.
In Kenyatta here, fortunately, there's a social welfare system which can waive or give free treatment for those who cannot afford to buy NHIF card, or those who cannot afford to pay from their pockets.
Nickname Mark Willie, Dr. Tele.
You need to meet Joshua to appreciate what it means to overcome fistula in dignity. In Joshua and others, Dr. Otele finds his inspiration, that and the expectation that other similarly suffering men will find the courage to seek a medical end to their sorrow. For Citizen Live at 9, I am Ann Mawade.
Can you believe these scissors will cost you like 2,000-3,000 shillings in India, and you can buy it in a kiosk?